As a neurosurgeon, I've treated thousands of patients suffering from low back pain and leg pain. 80% of the population will experience low back pain at some point in their life. At any given time, 31 million Americans experience low back pain. Since low back pain and leg pain are so prevalent, I'd like to devote this discussion to a question which is often misunderstood, and that is, what is the difference between low back pain and leg pain? It's only through the understanding of this fundamental difference that we can start to understand the different treatment strategies and the different causes. A big misunderstanding which I often see, and one which is not well appreciated by most patients, is what is the difference between low back pain and leg pain? Ask yourself the following questions. Can a low back problem cause leg pain? Is the cause of low back pain and leg pain the same? If I fix the low back pain, will the leg pain also go away? If I fix the leg pain, will the back pain go away? This is Dr. Kraus, and today I'm going to discuss the important differences between low back pain and leg pain. I'll refer to mechanical low back pain as pain which stays predominantly in the low back. The patient may experience occasional aching in the lower extremities, but the major pain which is bothering them is actually in the low back. The pain may be dull, sharp, aching, or stabbing, but again, it remains in the low back. This is to be distinguished from pain which predominantly shoots down the leg, lower extremities. That type of pain, also known as radiculopathy or sciatica, often radiates down to the back of the thigh and may go to the back of the knee, or it can go all the way down to the feet. It's important for the patient and physician to evaluate whether the main area of pain is in the low back or the leg, because this difference will help to determine what the best course of treatment is. To better understand the differences between low back pain versus leg pain, and what causes the two, let's begin by going over some of the pertinent anatomy of the low back. The spine is what holds us erect and allows us to stand and to walk. It also contains and protects the spinal cords and nerves of the body. When we are speaking of the lumbar spine, we're not generally talking about pressure on the spinal cord itself, because the spinal cord is not present in most of the lumbar spine, but rather we're talking about the nerve roots themselves. Let's first start out by discussing lower extremity or leg pain. Patients often ask, why do they experience pain in the legs when there's a herniated disc in the low back? That's a question which can be best explained by showing and understanding the anatomy of the lumbar spine. We can see that the lumbar spine is composed of bones known as vertebral bodies. In between the vertebral bodies are the discs, which are soft shock absorbers located between the adjacent vertebral bodies. Behind the vertebral bodies and discs is the spinal canal, through which the nerves run. These nerves will travel through openings known as the neuroforamina, and they pass down these openings to get to the lower extremities. Each nerve travels to a different portion of the leg and supplies sensation to that portion. In other words, the nerve fibers from that particular nerve allow sensation from the adjacent segments of skin to be transmitted through the nerve and backed up to our brain. It is through this mechanism that we are able to feel pain. The portion of the skin which is supplied by a nerve in this manner is known as a dermatome. Each nerve has a different dermatome. We can see that the L5 dermatome goes to the great toe of the foot, whereas the S1 dermatome goes to the outside of the foot. The number given to each nerve in its naming pertains to the different vertebral body through which the nerves exit the spine. The nerves also supply motor function and allow us to move the muscles of the legs, but we won't go into that detail in this discussion since today we're focusing on pain. We can see that different nerves supply sensation to different portions of the leg. In a similar manner, when a nerve is being pressed on, we may perceive the pain to be coming from the portion of the leg to which the nerve travels. A more technical term to describe where the nerve travels is to say that the nerve innervates that portion of the leg. Understanding this, we may understand now why pressure upon a nerve in the back can cause pain to appear as if it is shooting down the leg or coming from the leg. This shooting pain is known as sciatica or radiculopathy. Again, more technical terms to describe the sensation of pain going down the leg and being caused by pressure upon a nerve in the low back. This can easily be seen on this cross-sectional anatomy. There are a number of issues or problems which can cause pressure upon a nerve in the low back. We'll list them here, but we won't focus upon the details of any one of them. A herniated disc is seen here, causing pressure on a nerve as it's leaving the spine. Spinal stenosis is a degenerative change of the ligaments of the spine, often coming with an aging process, and causes circumferential constriction around the nerves of the spine. Spondylolisthesis is a term which describes one bone slipping on the other in the lumbar spine, and this can cause pressure both centrally on the nerves as well as where they exit the spine. Spinal fracture can occur as a result of osteoporosis, weakening of the bone, or as a result of trauma to the spine. Generally, osteoporotic compression fractures are less likely to cause compression on the nerves, but traumatic injuries and fractures to the spine are more likely to do so. Other causes of compression of the nerves include spinal tumors. These can include tumors which grow from the vertebral bodies or the bone themselves and press externally on the nerves, or they can grow from the covering of the nerves such as the dura, and cause pressure on the nerves themselves as well. Other issues which may cause pressure on the nerves include hematomas, which are blood clots around the nerves, and there are other causes as well that we won't discuss here at this time. Now, let's discuss low back pain itself. Low back pain is pain which is typically limited to the lower back and does not travel down to the legs. Since this is the case, we can imagine that pressure upon the nerves is not the major issue, but rather other factors which cause the mechanical low back pain, and which we will now discuss. The back is supported by the vertebral bodies of the spine, with discs situated between the vertebral bodies. They are held together with many ligaments. The adjacent bones move and slide upon each other across the disc bases as well as across the facet joints. Both of these contain cartilage. There are many muscles which connect different parts of the bones to each other. Pain may arise in the low back from injury or degeneration of any and all of the components. Trauma to the disc can cause low back pain. The disc can be thought of as a radial tire, with the soft nucleopulposus on the inside and the firm annulus fibrosus wrapped around the soft inside. If there is a crack or tear in the firm annulus fibrosus outside fibers, then soft material from the inside of the disc can push between the fibers of the annulus and cause mechanical low back pain. Pain can also arise from degeneration of the cartilage of the facet joints and of the disc spaces. This is known as arthritis and can cause mechanical low back pain. Pain can also come from sprain of one of the many ligaments which hold bones of the spine together. This may involve a tear or a stretch of the ligament. Another source of pain can be strain of a muscle or tendon, which is a tear or stretch of the muscles or tendons which connect to the bones and help to support the bones and hold them together. We can now understand that the causes of back pain and leg pain are different. It is very common, however, that one experiences both back pain and leg pain at the same time. Some of the causes may overlap. For example, a herniated disc may separate and irritate the fibers of the annulus fibrosus, causing back pain, but it may also press upon the nerves of the spine, causing leg pain. This can cause both low back pain and leg pain at the same time. We might have trauma or degenerative changes of the spine, which can cause instability between the vertebral segments. This can cause mechanical low back pain in the spine due to the stability and the weakening of the ligaments, and the movement of the vertebral bodies adjacent to each other can also cause pressure upon the nerve roots, either centrally in the spine or as they leave the spine. Therefore, this can also cause mechanical low back pain as well as pain to the legs. Development of significant arthritis in the facet joints can cause pain in the joints, resulting in low back pain. The same overgrowth of arthritis in these joints can also cause pressure upon the nerves as they exit the spine through the neuroforamina, resulting in leg pain as well. I hope we have a better understanding of the fundamental differences between low back pain and leg pain. Understanding this difference is important. because the treatment for the two different types of pain may be quite different. If you would like to have a question answered by Dr. Kraus, just complete the form at www.spinhealth.com/contact-us.php. In the contact form, you'll notice a box requesting insurance. In this box, just simply type Ask Dr. Kraus. Thank you very much for listening, and we look forward to seeing you soon next time.